Hello, dear friends. Welcome to another in our JBS series, Gam Yachad, Together during COVID-19. If you know the Hebrew folk song, Hine ma tovu manayim, you know the song ends with the phrase, Shevet Achim Gam Yachad. Behold how good and wonderful, pleasant it is for brethren to be sharing Gam Yachad together. And so as we battle the coronavirus together, we'll be with you, Gam Yachad. I hope you had a nice weekend, as stress-free as possible. And thank you, those of you who've been sending me the loveliest of emails, thanking me and the entire JBS staff for this series and simply for being with you. So Suzanne, I want to thank you again for all the kind words you had for me and for JBS. It was wonderful to read. And Regina in Aventura, Florida, thank you as well. All of you who've written me, you have no idea how much strength and encouragement your words bring to all of us here at JBS. So one of the things that I really want to address on this series, Gam Yachad, is the level of fear that's creating such enormous anxiety and stress. And I know there are many of you who are living alone and you're separated from the people you love. In some instances, from the people you've relied on to care for you. And we're all, in essence, homebound. We're all homebound. And one watches the news or reads the news, it can be very frightening. And the next thing you know, there's this sense that the coronavirus is everywhere, on every surface you touch, on any package delivered to your home, on any person you come near. And there's a sense that it's only a matter of time before you are infected by the virus. That's how so many people are living these days. And there's no question, this is a very dangerous virus, especially those of us who are above the age of 60, and even more so if we have underlying health conditions, and who doesn't. But as dangerous as this virus is, and as serious as our efforts must be to protect ourselves from contracting this virus, there is a reality which is also very important for us to understand. And so I want to share with you a conversation I had with one of the world's foremost experts in the field of infectious diseases. His name is Dr. Allon Moses, and he's the head of the Infectious Disease Department at Hadassah Hospital in Jerusalem. I think you're going to find Dr. Allon Moses to be a most compassionate and warm individual, what we all hope for in a quality physician. And he has a very important message for all of us. Here is my conversation with Dr. Allon Moses. I am so pleased to be joined by a man who's on the front lines in the state of Israel, Dr. Allon Moses, who's he's director of clinical microbiology and infectious diseases at the Hadassah Medical Center in Israel. And Allon, thank you so much for joining us.
Thank you. It's my pleasure to be here with you.
By the way, you're in the Hadassah Medical Center group. Where are you physically located?
In Jerusalem at the Hadassah Medical Center. I sit in the Ein Kerem campus, but the department gives service to both hospitals, the Ein Kerem and Mount Scopus Hospital. So it's one department for both hospitals.
Okay. Where did you do your medical training, Allon?
I studied medicine in Israel, in Beersheba. I was actually the first year when the school began. I don't know if the people are familiar with it. I had the opportunity to study both at Hadassah and in Beersheba, and I chose to be a pioneer, to be the first class there. And then I did my internal medicine training at Hadassah, and my infectious disease training in Boston, in the Harvard hospitals in Boston.
Very nice. By the way, just so our audience understands, Allon, microbiology and infectious diseases. We have a sense of what infectious diseases is. What's your work in microbiology?
Your questions are excellent.
Thank you.
The department is called the Department of Clinical Microbiology and Infectious Diseases. This means that under one roof, we have the clinical microbiology laboratories and the infectious disease doctors. This is a highly unusual situation. Usually, the infectious disease doctors are part of the Department of Medicine, and the clinical and the labs are part of the labs. We feel that this combination allows us to give much better service to our patients. We deal with the diagnosis, treatment, and prevention of infectious diseases on all its aspects.
Okay. Very, very briefly, I have a lot of questions I want to ask you, but my first question is a general umbrella question. As you're experiencing the pandemic right now in Israel, how do you feel Israel is doing overall? How concerned are you that the coronavirus will become a major threat to the Israeli people and will take many lives? How would you describe Israel at the moment?
Well, we've been in the pandemic now for 2 months, and we have the opportunity to be a little bit behind the rest of the world. So I think it's really an opportunity to plan better. I mean, the whole Western world watched China go through the tsunami of the epidemic at the time.
Yes.
And some were prepared better, and some did not prepare. I think Israel looked at what is happening in the East and began to prepare. I can tell you that I was part of the decision to stop Chinese. There was a Chinese dancing group who wanted to come to Israel almost 2 months ago, and I was part of the people who stopped it. Because
Really?
Early at that time, we sort of had the feeling that something bad is going to happen. And about a week or 10 days later, some other countries closed the airports, and it evolved slowly. So I think Israel has been preparing relatively well. At this point, it's still difficult to say if the preparations are successful. We now have 2,500 cases. We've had 8 deaths. If you look at the other countries, of course, there are countries who have many more cases, but to understand the disease, you really need to look not only at the number of cases, you have to look at the number of cases per population.
Yes.
And you have to look at the number of deaths per the number of cases. And Israel is doing relatively well in terms of the number of deaths. We have 8 deaths till today, with 3 additional ones today, with the denominator being around 2,500 cases. So in that sense, we're at this point, if you look at the graphs and we look at the increase every day, we have too many new patients. We have quite a number of new patients daily, but fortunately the mortality has stayed low.
Okay.
I think
Allon, when you talk about, in essence, the denominator is not how many cases have been identified. It's how many people have been exposed. And one of the things that I keep hearing is that in reality, no country has, certainly not America, has not done enough effective testing on a wide population to really know what the denominator is, to really know how many people have been exposed to the virus. And it's people who've been exposed under the number of people who have died, which really is the key number. It's not, and most of the time we talk about how many people do we know have the disease, and then how many people have died, and we use those two numbers to come up with a ratio or a percentage. But am I not correct that really the overall number should be the number of people who have been exposed in any sample group?
There are two ways of looking at the denominator. One is the one you've described, and to say, this is what we see is only the tip of the iceberg. We have to test everybody to know what the true number of infection is. That's one way of looking at it. But another way is to say, okay, there are people who are asymptomatic infections, and it's difficult to know exactly how many asymptomatic. So let's look at the mortality out of the patients who are symptomatic.
Okay, I understand.
But let me just one more comment. I think it is important to do more testing, not so much to know the percentage of death, but to be able to identify those who are carriers and to put them in quarantine so that they do not infect others. That's the main reason I am for testing much more than we're testing.
And very quickly, how well do you think Israel has done in testing?
In the beginning, not enough. In the first, just 3 or 4 weeks ago, we had only one lab doing the tests, and we were doing 100 tests a day. It was ridiculous. Mm-hmm. And it took the Ministry of Health, unfortunately, too long to reach the current situation where instead of one lab, there are 15 labs. Instead of 100 tests a day, we now can easily do 7,000 tests a day. And that's around reasonable. With the aim is to be able to do 10 to even 20,000 tests a day.
Wow.
There's debate whether we should go in that direction. I think we should.
Okay. Look, one of the things that concerns me alone most in this pandemic is the way it is creating enormous anxiety in people. People are very scared. And I'm concerned with the extent to which this fear and panic, especially among older people, many of whom alone watch JBS, and many of them live alone, if there's anything we can do to clarify for them the extent to which the danger is likely to affect them. So I'm going to ask you a few questions. You may know the answer. And by the way, if your answer is, I don't know, I consider that to be a valid answer. But I'd love to understand from your perspective, as someone who deals with infectious diseases, how much do we really know about the way in which the coronavirus, COVID-19, actually operates? And by that I mean I understand it to be respiratory, and that it basically is affecting and attacking a human being's respiratory system. Is that starting there alone? Is that an accurate description? Is this a respiratory infection and virus?
It definitely is. It causes an infection of the lower respiratory tract, pneumonia. Many patients who are infected have infiltrates in their lungs. And I think we know now, you've mentioned this before, that there are probably many more people infected than we know. This means that a large proportion of humans infected will have a very mild or even asymptomatic disease. So, I mean, that's the good news. The less good news is that relative to other respiratory viruses, this virus spreads very extensively. We know that there is a reproductive number, it's called the R naught or R0 of coronavirus 2 is rather large. It's between 2 and 3. That means that every infected person infects an additional 2 or 3 other people. That's much more than the seasonal flu.
Okay, Allon, I haven't heard anyone explain why that is true. Why is this virus? Why is this virus more easily communicated to another human being than any other virus, especially, Allon, when this is, I understand this is not airborne, which means you only get this virus if you come in contact with it in one form or another. And by the way, I should ask that question separately, because I've heard some people tell me, oh no, Mark, it is airborne. Allon, is this an airborne virus or not?
We think that it's mostly not airborne. Now, this means that since it's a new virus, the answers are not completely clear. For influenza, we know that it's airborne. If you remember SARS from 2013, it was not airborne. It was a droplet, through droplets. But we know from SARS, from 2003, that the infection occasionally, there are people whom we call super spreaders, and they spread it in an aerosol, which is airborne. So we think that it's probably transmitted by droplets. But let me come to the beginning of your question. Why are so many humans infected? The reason for this is, it's transmitted by droplets mostly, but since this is a completely new virus to humans, the population of the world does not have any antibodies against it. It's an introduction of a completely new virus. If you compare it to the flu virus, which we've known for many, many years, since we meet the virus every winter, and again, we develop antibodies. Even though the virus changes a little bit, we develop protective antibodies, and therefore the disease does not cause such an extensive involvement of the population.
Okay, but excuse me for interrupting. That doesn't make sense to me, and I'll tell you why, and I'm probably missing something you can clarify for me. It's not about, when somebody says that this virus is very easily transmitted, and then people say it's transmitted to a greater extent in worse ways than, for example, the influenza virus. They're not talking about whether it's transmitted to people who do or do not have antibodies. You may say to me the real problem here is not that it is transmitted more than the influenza virus, but that when it is transmitted, human beings have no resistance, no natural antibodies in their system. That only means that more people are at risk if they get it. It says nothing, however, about the extent to which this virus or another virus goes from one person to another. So I'm going to change the question now to ask you, is the real issue here, which is not understood by most lay people, it's not a question about how much it's transmitted. The danger is that most people to whom it is transmitted do not have antibodies, whereas in the case of influenza, it may be transmitted just as much, but more people have resistance to it, and therefore the spread is not as wide within the population.
I think your point is very well taken. It's a combination. One factor is what we call the reproductive number, and that is the transmissibility. And we don't really know what the mechanism of that is. Some viruses have a higher reproductive number. Measles, for example, it's 18, close to 20, and this coronavirus is 2. So the higher the number, the more people are infected from a single patient. So that's one characteristic. And the other is the point that I mentioned about the lack of antibodies. So it means that if the transmissibility, if the reproductive ability is high, many people will be infected, and this is augmented by the fact that the population doesn't have antibodies against it.
Okay. I want to come now back to the question, how does it spread? This is what we're told in America. I'd like to know, Allon, is it being said the same way in Israel? And then we'll talk about how efficacious these methods are. We're told, number one, keep your hands very, very clean. Soap them with soap and water at least 20 seconds. Sing happy birthday twice. Use disinfectants. Keep your hands clean. Number two, stay away from other people, especially those you don't live with. You don't know anything about them. You stay at least 6 feet away from them. And we're told the reason for that is because it is droplets that might be secreted by an individual, either by a cough or a sneeze, or even by the way they breathe. The droplets, which are not airborne, drop to the ground, and if you're 6 feet away, the likelihood of your being infected by this droplet is very, very, very low. And then third, keep your hands out of your mouth, your nose, and your ears, because even if you have it on your hands alone, if your hands do not enable it to get into your respiratory system, and then at one point you do wash, you are protected from that virus. And it seems so simple, not easy. It's very hard to do those three things, especially not to touch your eyes, nose, and mouth, because we do it all the time instinctively without thinking. But if these are the rules, which if a person observes them, and I'm now talking about alone, somebody who's elderly, living alone in an apartment or a home, and they're in their home and they're safe, and they wash their hands. Nobody comes near them. They don't touch their mouth, their eyes, or their nose. Is it safe to assume? Is it logical to assume? Is it reasonable to assume that person is relatively very, very safe, and the likelihood of their getting the virus, because it doesn't seep under the door, it doesn't come in by magic, it's not in the air, if one follows the rules. An older person who follows those rules should not live in constant anxiety and fear. To what extent is what I'm saying something you can agree with? Where do I have it wrong?
I have nothing to add, Mark. You did this wonderfully. You explained it better than any way I could explain. I'll just add one thing.
Please.
Everything you said is right. The reason about the transmission, the droplet transmission and the distance, I agree with everything. The point of hand washing and not touching your mouth is most not when you're home, but more when you're out of home. If you go out and you touch a surface that someone touched or sneezed on or coughed on, then you don't want to touch that surface where the virus may stay, and then put your hand in your mouth or face. When you're at home, and if you stay at home, the washing of your hands is not that, you don't need to be that fanatic. And I really want to say my message is during these times, and in Israel we now have a curfew, almost a total curfew. And my message to the Israeli population, I said this on the television yesterday, and I want to say it here again. If you stay at home, you and your spouse, and you do not go out, you will not be infected. It doesn't, like you said it better than I could say. The virus doesn't come under the door. It doesn't fly through the window. You can open your windows. It is only transmitted from person to person. You need to be close to that person. If you stay at home, you're safe.
Okay, you say it so beautifully. Allon, what advice do you give to Israelis, or do you give to now the American audience? You're speaking throughout the country on JBS. What advice do you give about A, going to a grocery store and purchasing food, doing it wearing gloves, and then you come and you wash your hands to wash them over and over again, and you wipe down any package you might have purchased with some kind of disinfectant cloth? How safe do you feel people are doing that? Number two, would you ever order food from a restaurant? In America, all restaurants are closed for sitting down and dining, but many people now order their food from restaurants who make it and then deliver it. And so I'm asking you the extent to which people have to worry about how they get food and whether they eat food that has been prepared in a restaurant. What is your advice?
These are questions which we've never asked before. And therefore, the answer is not 100%. You know, I think that if you go to the grocery and you abide by the rules, like you said, then you're safe. You don't have to be, you have to be very careful, but you don't have to be over anxious about it. If you put gloves on, clean your hands with an antiseptic solution, throw the gloves away, clean them again, you're fine. I don't think that's the way you're going to get the virus. About the takeaways from restaurants, I'm really not sure what the answer for that is. Most probably, the restaurant, the person who prepares the food is going to use a mask and gloves, but you can't be sure. Most probably, if you take the food and you put it in the microwave for 60 seconds, you're probably going to kill the virus. So, I think there are ways to answer the problems, this problem of takeaways. I'm not sure it's been addressed scientifically, so I think it needs to be worked out.
Okay. In Israel, are there restaurants delivering food?
Sure. Exactly the same.
Okay. Would you order food from a restaurant for you and your family?
Now I hesitate. I'm trying to stay away from everything, but maybe I'm exaggerating. Since I don't know the answer.
I think you're very wise. By the way, imagine this. Somebody wants to just get out. They have a car in their garage. They go to the car with their husband or wife. They drive around and the window is down and it's a nice day. They never get out of the car. They drive back home, pull into their garage, get out of the car, and go back home. Any danger in that?
Only accidents. No,
you mean car accidents?
No danger of getting
right. And by the way, I just want our audience to know, I heard the exact opposite on Fox. It made no sense to me. So I'm glad I got to ask this of Allon Moses. Okay. So I'm going to ask you another question. You may not know the answer, and that to me is a legitimate answer.
Thank you.
There are 320 million people in America. Have you seen any projections of how many people are likely to contract the virus in that 320 million? For that matter, if Israel has 8 million, what percentage of the total Israeli population do you expect not will die, but will contract the virus?
There have been several calculations to that effect. You cannot say that the U.S. is one country. The U.S., in the New York, where the population is so dense, you cannot compare it to places in the country where the population is much less dense. So the more dense the areas, the more there's a question of infection. I think we're seeing in New York the ability of the virus to spread. So since, like I said before, since the whole population of Earth does not have any antibodies, so theoretically 60-80% of the population can be infected. That's why we need to take measures to try, social distancing for this time. We have to try and get through this year, which is the time we expect a vaccination to come in. That's really the goal.
Okay.
Vaccination and better therapies.
Okay. You said up to 80% of the Israeli population might be infected?
Again, maybe I'm overestimating it, but there have been some estimations that 50, 60, maybe 80% of the population may contract the virus at one time or another.
Okay, I'm going to use 50% for America. 50% would be 160 million. So far, the rate of fatality is roughly 1.3% in America. Does that sound right to you?
Well, we're coming to the question of the denominator again. I mean, if we look at the total number of people infected, 160 million, then I think the mortality will be less. But even if it's only 1%, it's still only 0.8%. It's still horrendous. It's still a catastrophic number of people.
Yes, but I want again to offer you a perspective, and I want to hear whether you're sympathetic to it or not. In terms of viruses, this seems like a very aggressive virus in that it is easily transmitted from one person to another if droplets are in some way transferred from one to another. And because, as you point out, the population does not have antibodies, whereas in many other viruses, people simply, it does not affect a person. In this instance, more and more, a very high percentage, for all I know, 100% of those infected will, in fact, have the disease, whether they have any symptoms or not. I understand that. And so when you talk in your line of work, as somebody who specializes in infectious diseases, this is a real horror. And it's appropriate for us to take all of the precautions perhaps possible, because we don't want to see 1 million or 2 million, or in Israel, we don't want to see hundreds of thousands of people die. No question about it. But I'm coming at it now from a different perspective. There's an individual. That individual is 70 years old, 80 years old, 85 years old. They're living in an apartment somewhere. They're living in a house somewhere. What's the chances of that individual coming down with the virus? And if in fact, whatever the percent, if the percentage is 1% of those who get it, and again, as you point out, the question is what the denominator we are using. The chances of any one individual getting this disease is like 99% unlikely that they will get it. And the reason I phrase it that way, if you agree with me, it does not minimize at all the enormity of this pandemic. but it should give individual people, viewers of JBS, viewers of people who come into the Hadassah hospital, people who are with you all the time. It should put this in a different perspective. And that, again, if your chances of getting this are only 1%, or there are only 1% of that you will die from it, and 99% you will not, or 96%, or 94%. That changes the perspective, I would hope, for individuals who, again, live with anxiety and fear. But you've been very honest with me, Allon. To what extent are you comfortable with my analysis, or do you think I'm missing something?
Mark, this is the exact analysis that I've been giving for the past few weeks. Let me phrase it a little bit different, but it's exactly the same condition. There's a difference if you look at the individual or at the population. For the population, this infection is horrific because even if it's just 1%, the 1% of a billion is 100 million or 10 million. It's millions. So even if it's a small percent for the population, it's terrible. For the individual, like you said, the likelihood that you or I will die if it's 1% mortality, like you said, it's 99% chance that we will not die. But and if you look at the, 80%, let's look a minute at the percentages that we know now. 80% will have a completely asymptomatic infection or very mild. Another 10% will have a more moderate type of infection. About 5 or 10% will be severely ill, and about 1, maybe 2% will die. So, when you look at the numbers of the whole population, like I said, for the individual, the chances are that he will survive it. There is a difference, and we must mention this, that in the elderly, the mortality is higher. So we cannot say that for the elderly, the mortality will be 1%. It's a little more.
Okay, so let's talk about that for a minute. 17% of the American population, according to the American census for 2020, 70% of the American population is 65 years or older. Based on a population of 320 million, that represents 55 million people who are 65 or older and who are in, as you've just identified, they're a greater risk. If 1.3% of them were to die, that would be 700,000 deaths. Again, on a social level, for a community as a whole, that would be, I'm using your word, catastrophic. At the same time, somebody who is 65 or older, if it were 1.3%, their chances of getting the disease and dying is minuscule, 98% probability of not dying. If older people die at a higher rate, which is your point, let's say we double it, that the rate is doubled. By the way, if I double the rate, is it too low, or would you say double the rate's about right?
Well, there are data showing, what is the likelihood of death over the age of 50, over the age of 60, 70, and 80. The numbers increase exponentially. So over 80, the likelihood is something like 14%.
Did you say?
But just when we give this is a pretty scary number, 14% of all patients over 80. But one person over 80 is not like another person. So someone who is with many illnesses, cancer or chronic lung disease, diabetes, then his chances are higher. I must say that you know, this is the reason the elderly and those at high risk is the reason to put an effort into what we call lowering the graph.
Yes.
Affecting the number of cases over time. Because if we have fewer cases over time, the medical system is not overwhelmed.
Yes.
And it can give better service. Look what's happening in New York. The system is overwhelmed. They are unable. This is what happened in Italy. The system was unable to provide the best care which it is able to.
Yes.
If the numbers are not so bad. So that's why social distancing and staying away from people is the solution for the next weeks and maybe more than that.
Very, very well said. So, Allon, you mentioned earlier that we're going to have to deal with this probably until a vaccine is developed. And what I've heard and seen is we're talking about a year to 18 months. Then in America, there's a big discussion now about a drug called hydroxychloroquine.
Chloroquine.
What do you know about hydroxychloroquine? And do you have are you optimistic in any way that this is a medication, a drug, that could in some way be an agent to dampen the disease?
You hit the question right on the mark. The hydroxychloroquine is a medication we know for 70 years. You know, it is a derivative of quinine, which was discovered in the 1930s. It was used against malaria. It's one of the safest drugs, and over the last few years, it's been shown to have some antiviral activity. Taking that into consideration, I think hydroxychloroquine is an optional drug to be tested under scrupulous conditions.
Mm-hmm.
You know, it's very easy for a doctor to come and say, I've given the medication to 400 patients and they all responded. Now, if you have 400 patients, the chances, 80 to 90% have a mild disease. So you must, to know that the drug is effective, you have to, and I'm a scientist at heart, you have to do a trial which is done by all the rules, which means it has to be a prospective, randomized, double-blind, placebo-controlled trial. And then you can say, yes, this medication is efficacious or not. If you look at chloroquine, which has been used now in patients with severe disease in China, it may have had some effect. The fever was for less time. The ventilation maybe was shorter, but it's not been decided yet. So I do not think it's correct now to start taking hydroxychloroquine, Plaquenil. It's a mistake because we don't have the data.
I understand. Is it being at all tested at Hadassah?
We're actually beginning, we've planned the study. I don't want to elaborate on it because we're not there yet, but we're planning to do such a trial.
Okay. In general, Allon, how do you feel Hadassah Hospital has, on the one hand, been effective in dealing with patients who come to you? And are you facing any shortages of ICU beds or ventilators?
At this point, we still have only a few patients. It's growing exponentially. In Israel, there are 2,500. It's expected to be, we're doubling our numbers every 3 days. So in 10 days, we'll have 10,000, and then we'll be crushed. So at this point, we're not there yet, but Hadassah is preparing. We made a special unit for corona patients and a special IC intensive care unit. So we now have approximately 30 beds. Next week, we'll have an additional 30 beds for a regular ward, and we're planning on another 70 intensive care unit beds. So, the country is preparing. Nobody is ready for such a terrible...
Yes.
And that's why social distancing, please, stay home. You're not going to be infected.
Absolutely.
That's what I tell everybody.
Absolutely. What's your family situation? You have a wife?
I have wife. We have 4 children, no grandchildren yet.
Very good. Mazal tov on your children. I ask only because there are ethical issues being raised, and I wanted to know, first of all, in terms of your own family, is Judaism and Torah in any way part of your family's life or not?
No.
Okay. As an Israeli who deals with medicine all the time, when you hear questions like, if there is a shortage of beds or if there's a shortage of ventilators, how does a hospital, how does a society decide who is treated and who is not? And is the treatment based on age? From your perspective, and I know many hospitals have ethical committees. I don't know if you're on it or you're not on it, but I'm sure you've given these thought, and I'm sure you've talked to other people, your colleagues, about this to one degree or another. Allon, what's your sense of the ethical issues that are confronting our society now because of this disease?
I think this discussion is very important. We're going deep into the essence of the crisis.
Yes.
I'm not sure you and I can solve it.
Yes.
I think that the question of who to give ventilator is a critical question. I really think it's best to discuss it, and I've been discussing it with my colleagues and
it's
opening
hard,
the
isn't
question.
it? It's a hard issue.
It's a very difficult,
and it's a painful issue.
Question. It's a painful issue. Nowadays there are people who are actually have no contact with the outside world, who are being ventilated for a few years. Should they be taken off the ventilator to allow a younger person who has his life ahead of him? Can we take someone off a ventilator? Can we decide that someone, have a score of this, age, disease, longevity? Can we choose who to ventilate or not? We can discuss this for a while, but I trained in the army, and when you train as an army doctor, you learn that if you have a mass casualty, you have to decide who to give, and you're on your own or your means are limited. You have to decide who to begin treatment. So the person who is most severe, you don't go to because you can't save him. So you go to the person who is, you don't go to the person who is least injured, but you go to the one who's in the middle, because you can save him. And the first person who's critically ill, you're not going to save. The other one is going to save himself. So you're going to, this is what we learn in the army.
That's very nice.
And you have to discuss it, because we're going into these terribly difficult decisions.
Yes. How does your wife feel and your children feel about the fact that you're on the front lines now because you're at Hadassah Hospital. Do they worry for you? Do you say to yourself, in terms of your responsibility as a father and a husband and one day a grandfather, you have responsibilities to protect yourself? How are you handling this personally, Allon?
Well, I'm 66 years old, so I'm...
You're a kid. You're a kid.
So I'm already in the danger zone. We have a son who's a doctor, so we're concerned about him. I think the doctors have now learned to protect themselves. Unfortunately, we have very few medical personnel get infected. They get infected at home, but in the hospital situation, we have less infection. So that's good, but this is definitely a worry. I worry about our son. I worry about myself. I worry about my friends. Since we haven't seen the hurricane come over us yet, we're just looking at others, and I say that we are fortunate to be able to see others and what they've gone through and maybe plan better than others did.
Allon, I am in awe of you and your colleagues, the medical profession, kol hakavod, to nurses who are on the front lines in a very powerful way, to the doctors, to the ambulance EMTs, to aides, those who are orderlies and push people around, and all of you are, in essence, you're putting your lives in danger. How much danger we don't know, and what you just said is somewhat comforting. The people in the medical world now are able to protect themselves. We hope that Israeli doctors and nurses and all of you have enough gowns and masks and gloves, and I know you'll take care of yourself. But at the same time, what you're doing is a it's a heroic job. You are all, to me, you're all Nachshon ben Aminadav. You're the ones who are going forward, and you're making our lives possible. You're a very, very sweet, lovely man. I am so glad to have met you because of this horrific virus. It is my hope that one day I will be in Israel and get to literally give you a hug. But in the meantime, I wish you kol tuv v'hatzlacha and only good health. Stay safe. Be well. You, your wife, your children, and you have been wonderful to give us so much time here on JBS. Toda rabah. Thank you so very much, Allon.
Thank you, Mark. It was my pleasure to speak with someone so knowledgeable as you.
Thank you, my dear friend. We will talk again. You be well. Thank you.
Bye.
Bye-bye. The thoughts of Dr. Allon Moses, head of infectious diseases at Hadassah Hospital in Jerusalem. And I hope you heard him. If you stay at home and are careful with any packages that may come into your home, and you stay 6 feet or more away from anyone who may enter your home, you are safe. The virus is not in the air. It's not creeping under the door. It's not stalking you. You can only get the virus from contact with a person or a surface that has the virus on it. And if you keep your hands out of your mouth, nose, and eyes, even more so, you can't contract the virus. And this does not mean any of us should become complacent. We're in a war with this virus. And when you're in a war, you can't lose concentration. You can't get sloppy or lazy. But for anyone who remains vigilant and careful, there is little chance of getting the coronavirus. And as Allon Moses points out, for the hundreds of thousands, maybe even millions of people who will contract the virus, It's a real threat and a real problem. But for those who follow the rules, 98% or more of the population will never contract this virus. And that includes you. By the way, the rough coronavirus numbers today show that some 155,000 Americans have been diagnosed with the disease, with more than 5,000 recoveries and roughly 3,000 deaths. In Israel, there are now more than 4,000 diagnosed cases. 134 people have recovered, with only 15 deaths. And every death is a tragedy, especially for the family. But the number of people who have died from the coronavirus in the United States and in Israel is a fraction of 1% of our population. And that's a perspective we must keep in mind. I'm so pleased that many of you are sending me your simchas and sadnesses at jbscommunity@jbs-TV.org. And let me respond to some of the messages I've received. A Misha Berach for Joanne Daniels, who's being thought of by Arnie Nemeth. And a Misha Berach for Stuart Cantor of California, who's being thought of by Jane Cantor. And wish them a refuah shlema, a speedy and complete recovery. We're also sad to mention the passing of Arnie Nemeth's aunt, Iris. May her memory always be for a blessing. And we have a simcha to celebrate with our JBS family. Mazel tov to Sue and Larry Colden, dear friends and longtime supporters of JBS, on the occasion of their 55th wedding anniversary. And Sue and Larry, we send you all our love. And two quick notes. I'll be live on radio tomorrow night from 7 to 8 p.m. New York time on WSNR 620 on your AM dial. Also WJPR 1640 on your AM dial. You can also listen from wherever you are online at talklinecommunications.com, or you can listen on your phone by dialing 641-741-0389. And we'll even have a way for you to call in so I can speak with you directly. And to those of you who've asked if JBS will be having any kind of Seder for Passover, the answer is yes. And I'll have more details as the holiday approaches next week. But the answer is yes. And we'll be in touch with you often as we share this time, Gam Yachad, together. Until the next time, I'm Mark Golub. Stay safe and be well, my friends.